Hello, this is Dr. Do again. This video continuously from previous stream, a systemic approach of medicine. Basically, this series of videos connected the structure to the clinical diseases or presentations on a different level, from the invisible organic compounds and associated diseases, and then move on to the cellular tissue level, and then some representative or typical diseases, either quite be serious, could be quite be common, and also move on to the organ systems I have mentioned from different systems, and on the circulatory system, or cardiovascular system plus the blood. So this is about the circulatory system. When I talk about the circulatory system, it refers to the heart, the blood vessel, and the blood. When we talk about the cardiovascular system, it's just the heart and the blood vessels. So anyway, this is just some kind of concepts. You probably know it, or probably did not think that much. I just brought here because and today I'm going to talk about another important or common clinical presentations and associated with the cardiovascular system, the dizziness. So what are the causes of dizziness from the heart? I do have the video of dizziness. I think just broadly covered everything about dizziness, or either from the anemia, either from the other problem like the kidney disease or dehydration or metabolic, whatever the causes. But today I'm just focused on the cardiovascular caused dizziness, because it is could be not that serious, or could be quite serious. So that I'm just focused on that. First of all, the dizziness is the sensation of unsteady. Really, you've either from changing position or just without changing position, and a variety of causes, like I mentioned, neurological, or either some peripheral, like cranial nerves, like nerve 8. Cranial nerve number 8, if there's some problem inside of the ears, and or if the dehydration or electrolytes imbalance, or variety of causes. But what are the common causes of the dizziness by the heart or the cardiovascular system? I think the first common one is probably arrhythmia. Either the heartbeat is so fast, or the heartbeat is so slow. So that's probably one of the common causes of the dizziness. And talk about this heart, and this is the increased heart rate. Actually could be just from the heart, or could be from other causes, but I'm just focused on the heart, the arrhythmia. A lot of causes by this leading to this palpitation, either regular or irregular. For example, the AFib, fibrillation, or flutter. Those are the typical, particularly in those who had history of coronary artery disease, or had previous myocardial infarction, and increased risk of this AFib or fibrillation or the flutter. And on top of that, there's supraventricular tachycardia, for example. There's may or may not have the organic heart disease, but just the imbalance of the autonomic nervous system. For example, the parasympathetic versus sympathetic system increase the sympathetic level, cause this heart rate to beat faster. So that's probably, or could be organic, just the disease of heart, from a variety of causes, ischemia, or the inflammation, or the viral infection, many causes, or the structure of abnormalities. And all the bradycardia, which means decreased heart rate, also can have this dizziness feeling, particularly if it is if a lot of people we live, particularly the athletes, their heart rate is below the normal range. Bradycardia in normal person, and a lot of people live, even though not athletes, but still have the slow heart rate, but without symptoms. If the bradycardia, the slow of the heart rate cause dizziness, that means something is serious. So you need to check it to make sure, because if the bradycardia cause the symptomatic, may further progress to the systole, which is also quite dangerous. So, having said that, on top of that, the risk factors for this dizziness caused by the heart, regardless whether it's bradycardia or increased palpitations, either way, you need to, who are really at the risk, indicating serious problems. Again, older people usually, with known or unknown heart problem, or other conditions like hypertension, hyperlipidemia, obesity, and so these are the common causes of this dizziness by the heart. And there's some structurally diseases, like a structurally abnormal valves, for example, or the heart muscle, the walls of the chambers are hypertrophy, like the subvalvular obstructive myocardiopathy. So if that's the case, that's the medical term, but anyway, the regular term is the enlarged or the wall of the chamber getting thick, block the passage of the chambers to the blood vessels. If that's the case, then also can associate with this dizziness, or some viral cause and myocarditis, just the inflammation of the heart, also can have this either with or without arrhythmia, but can cause this dizziness. And endocarditis, or there are so many variety of these conditions can cause the dizziness from the heart problem. So the take-home message, I think this is first of all, for those young person, the common cause, in addition to the non-organic conditions like just the dehydration, lack of rest, or and there's some heart causes for those young people, probably just for I just mentioned, either the viral caused myocarditis, or the structure abnormality which was not diagnosed, like a valvular disease, not diagnosed. So that's probably for young people. And for the older people, then the cause of dizziness from the heart is really indicating serious problem. Like I said, those who had a history of cardiac diseases, previously history of MI, myocardial infarction, or AFib, a flutter, or bradycardia. Those are all the dangerous or serious causes for this dizziness. So, having said that, it's kind of, I just think about it, probably I missed something, but the other causes of this dizziness from the heart is not directly or indirectly electrolyte balance or imbalance, I mentioned before, but I'm focused on the heart itself, the organ of the heart that can cause this dizziness. Basically, I just mentioned those long list of the etiologies. The taking home message is, if you have dizziness, regardless young or old, if you have dizziness, it's really, if it does not go away by resting or by rehydrating yourself, then you need to talk to your physician to see, may or may not be caused by the heart, but still indicating there might be something else going on serious. So just talk to your physician to get advice, to get diagnosed. So I'm going to stop here, and I hope it helps, and thank you for watching. I'll see you next time.